Welcome back to the All Hazards Prepper podcast. My name is Blake, your host of the All Hazards Prepper show. Super grateful that you have joined us here today. Today we have a special guest here on the show. Tim is a critical care nurse and a relatively new prepper to the prepping community, so please welcome him. He is currently a nurse, a critical care nurse at a hospital located on the North Carolina coast. He is also going back to school to become a nurse practitioner and currently also has his MBA. Currently residing on the North Carolina coast, he is always looking for new ways to further his prepping skills, knowledge, and plans. Today on the show, we will go discuss medical preparedness and why we might not want to rely on hospitals and medical facilities following a disaster. Please welcome Tim to the All Hazard Prepper show.
Blake, thanks so much for having me. I'm very excited to be with you tonight.
Great. So if you kind of want to go a little bit more introduction about yourself, and then we can kind of get into some of the questions we've talked about and talk really about, the issues that could occur when you're trying to go to the hospital or to a medical facility, following a disaster or during a disaster, and just kind of start talking about why you're prepping and what you're prepping for.
That's a good question. And in general, just as much of us are seeing the events of the world, it's looking more and more like something could happen. And I guess most people don't remember just a few short years ago, the pipeline that supplies gas to our area was shut down for 3 or 4 days or so, and it created havoc down here. And I can foresee something that lasts longer than that or more nationwide than regional, really having a negative impact on places like hospitals and urgent cares, in that if nurses and doctors and ambulances can't get to the hospital, there may not be a place to go to get help. So being able to do some things yourself before you have a chance to get to the hospital is certainly beneficial. And I'm not going to try to plug any first aid book, but there's tons of first aid publications out there. But basically, if you're bleeding, you want to try to stop the bleeding. And if there's a hole in your skin, which normally that's where blood comes from, for instance, you want to try to get it clean. When we bleed, that's part of what the action is the blood is trying to remove some of the debris that may be in that puncture or tear of your skin. But other than that, things like soap and water work really well. Isopropyl alcohol, of course, is very good and relatively cheap. And as a prepper, I think we should all have whiskeys or bourbons or something like that on our shelf. It has multiple uses, but you can, of course, use that to put on your skin or wherever it may be to help clean and disinfect a wound. But using things around your home, you should all have Band-Aids, of course, but clean bandages, depending on the size of the wound. Just something that will keep more germs, more dirt, more debris out of that injury will help you from getting an infection that needs to be treated at a hospital. So just the basics is where I think we should all try to be first, instead of trying to learn advanced medical knowledge. Being able to clean a wound, even for your spouse or your children, knowing what to do and how to do it is I think, step one. Your step two is going to be your daily medications. If you take very important items like medicines for AFib, medicines for blood pressure, medicines for diabetes, things like that, you really need to, I think, be proactive on and get as much supply as reasonably possible for you, in that if there's a disruption in the supply chains where there is no gas, there is no electricity, that you have at least a certain amount of time that you can maybe get out of your current situation to a better situation, where the pharmacy you may go to could be closed, but you still have some cushion there with your medications. Going without things like insulin and your blood pressure meds can really be a bad idea. And you just want to try to have as much supply as you reasonably can on hand and have it ready to go. people talk about bug out bags. Have one for meds. Make sure that if you need to leave in a hurry, you're not scrambling to find all of your medicines. They should be in one place, easy to go at all time. And other than that, just general preparedness of having those supplies on hand. I know a lady who goes to Dollar General or dollar store every week and spends $10 or $20. That's her little budget, and she buys things like Band-Aids and things that she needs for her prepping. So it doesn't have to be expensive. It doesn't have to be too elaborate to start.
Yeah, that's kind of what I've been preaching here on the All Hazard Prepper Show, and then through my content creating is, a lot of people think that prepping is some expensive thing or something crazy you have to do. But I mean, even myself, I'll go to the Dollar Tree and buy $40-$50 worth of stuff in there, and just it's just a stockpile of meds and Band-Aids and things, canned food and stuff like that. So it doesn't have to be expensive. So great points there, Tim, on what kind of some basic things that we need to do. Working in the medical field. I don't know if you were in during COVID or not, or didn't see some disasters or anything. Can you talk about what it is, or how overrun it can be, especially if you just need something simple. How long you might be able to have to wait during a disaster, or I know there are a lot of healthcare facilities and hospitals are facing, staffing shortages and things of that nature. So maybe just talk a little bit about, that issue there.
That's another good question. And oddly enough, staffing shortages is a topic that for my FNP classes that I'm working on, and it's still a global issue. And third world countries, of course, have a harder time keeping medical staff. But at the same time, major countries, U.S., Britain, Canada, Japan, Germany, everybody has a need for nurses. So it wouldn't take much of a disaster, much like another COVID, for it to snowball. And part of my research has been that the COVID pandemic caused so much trauma within the medical profession that a lot of nurses and other people that work in the medical field have said, I'm done, I'm out, I can't do this. So it exposed a lot of weaknesses. And I came in just after that, but knowing a lot of people in healthcare, I heard a lot of horror stories about the conditions and the way people suffered, and traumas on families and things like that. But yeah, it's something that certainly can happen again, and something that would certainly put a strain on the average individual. Even if you didn't suffer from the situation itself, like COVID, it makes things like routine surgeries, tonsillectomies, gallbladder surgeries, knee replacements very, very hard, because of you going into that environment where people are sick, and then people don't want to go to do the work on people during that situation. And then something that did happen at local hospitals is that those OR nurses got moved to the floor to take care of patients. So there wasn't actually OR staff to even do surgeries unless it was an absolute emergency. So there was a lot of people afterwards that were getting knee replacements and hip surgeries that couldn't get them for 2 years during the pandemic. So yeah, it's something that even if you're a very healthy individual and you suddenly break an arm, it would impact you during a situation like that.
Certainly. And as something I see in as an emergency manager, a lot of times during disasters and following disasters, people are using chainsaws. There's, people are driving through flooded roads, and, it increases the dangers and the hazards and the safety risk. So you see a lot more, injuries because of the disaster that's occurred. So making sure that you have ways of preventing, that and to start with, making sure that you know what you're doing. If you're using a chainsaw, if you're cleaning up equipment or cleaning up debris and trees and stuff, or trying to prepare or get your house right after a flood. You see a lot more disasters, related issues due to that. So certainly some great points there, Tim, and great things that we all need to focus on, no matter where you live in the United States. A disaster does not affect just one community; it can affect everywhere. So, great points there, Tim. Just talk about maybe some resources. You kind of hit it on some of that before, but
Mm-hmm.
what are some resources that you feel that everyone should have? And like other than the basic first aid stuff, what's some other things that can help someone during or following a disaster to help prevent them having to go urgent care or to a hospital or something?
I will tell you something that I see a lot on social media, that people are asking, where can I get antibiotics? And there's a lot of companies that will sell veterinary quality antibiotics to humans, and people are buying it and paying a lot of money for it. But something that the layperson may not realize is that penicillin is an excellent drug for a lot of things. It is not the go-to drug for everything. So in the right condition, you can be taking, because you're probably not dosing correctly, extra amounts of penicillin or ampicillin, amoxicillin, or something like that that's easy to find, and doing more harm to your body than you're doing good. You're not killing the germ that you're trying to kill, but you're killing good germs or bacteria in your body that's going to cause another disease that takes another kind of antibiotic to eradicate. So I really wouldn't, unless you know what kind of bug you're trying to kill, try to stock up on any sort of antibiotic. That's just my take on it. Just because in the hospital setting, there's 5 or 6 that we use, and they're very broad spectrum, but you could easily get the wrong one and not do yourself any good. And you have that false hope that you don't need a doctor. And in the meantime, you're getting sicker than you thought. So there's that aspect of it. But on my end, what I've been doing is things like ibuprofen. If you're out having to tote a 20-pound ruck to get from point A to point B, you're probably going to have body aches. And if you're getting older, like I am, body aches are fairly common. Ibuprofen is a good, relatively inexpensive medication that everybody can have on hand. Benadryl is another good one. It's not a solution for a snake bite or other things, or bee bites, but bee stings, I mean. But if you're allergic to things like pollens or bee stings or whatever, Benadryl is a very good drug to have on hand, because it can certainly save your life. I bought a big bottle of that at Costco, for instance, and I haven't taken it myself personally in many years, but it is something that I may need it, or somebody I know may need it in an event like that. Tylenol, of course, for fevers. It is very good for that. That's the only thing I would take it for. But it is something, again, relatively expensive. You can buy it literally anywhere, and it's easy to carry. It's fairly lightweight. So those are my 3 main medicines that I'm trying to have for me and my situation. And of course, there's others out there. You can buy the alcohols and the peroxides and iodines and things like that for first aid. But start, it's like a pyramid. Start with what you need first, the base, your home meds, the ones that you take every day, things that you know, like aspirins or Tylenols or ibuprofens. Get those next, and then slowly get the things that may come later that you may not be sure about. Do some research, talk with your doctor, and slowly integrate those into your prepping plan.
Great points there. Yeah, that's I always, tell people I did a whole week on medical preparedness and first aid when I first started this,
Mm-hmm.
and really, it's just look in your medicine cabinet, look in your closet, see what you have, and just get extra of it. Have think about, well, what if I'm out of this for a little while, or something like that, and that way you always have extra on hand when you need it. So, some great points there.
Mm-hmm.
Definitely. The antibiotics, I hear that a lot. Where am I going to get antibiotics during a disaster? And yeah, there are some great companies out there. They're expensive, but they do offer that. But you definitely don't want to take the wrong thing during a disaster to make your situation even worse and to add to the problem at that point. So great points there. Tim, what's some training or some things that people might that are interested, starting out preppers? What's some things that you would recommend, one to know, some basic first aid or something like that? What are some top, disaster or some things that you might see that come into the ER during a disaster that someone could really, do at home or, with a little bit of training beforehand, take care of the problem before having to go to an urgent care or to a hospital?
Something that I see a lot is establishing a baseline. And when you come up on a trauma and somebody is talking, sometimes they make sense, sometimes they don't. A lot of times that is due to you and others in a triage situation. If your mom's had a prior stroke and can't speak as well as she could or should, everybody knowing that will know this is not a new situation, has to be addressed, for instance. So I've seen people come in with a list on an index card of all their medications, for instance. Maybe they had a hysterectomy in 2000. They had gallbladder surgery in 2019. Just some basic information, what drugs you take. So if you're not able to communicate with a responder or a nurse in an emergency situation, being able to know that they're allergic to penicillin, they are diabetic, things of that nature is very good to know. A lot of times people are, as you've probably seen, in situations, and it's not such a trauma, but they are low on insulin, and just a simple blood sugar check shows that their blood sugar is low, and you can easily get that back up without a lot of hassle. So having your situation such that it can be made relevant to others in a situation like that is something we should really all think about. Allergies are huge. You don't want to take a medication that you're allergic to anytime, but especially in a bad situation.
Yeah, certainly. That's a great point there. A lot of times I was a firefighter as well. A lot of times during disasters or storms or whatever, snowstorms, people would call us, wanted to be transported to the hospital because they're low on insulin or they're low on oxygen or, they didn't really prepare beforehand. So I wanted to go to the hospital because, the hospital has those medicines and that oxygen or whatever they need or require. So some great points there. Kind of wrapping up, Tim, what are some other things that you as a prepper, feel like you need, if you're just starting out with prepping, how are, what's, the top disasters that you're kind of prepping for, just kind of wrap us up there, with your expertise and just starting out with prepping, what's some things that everyone should be doing that we haven't discussed here today?
Well, in general, I'm trying to get back to some basics. My parents and grandparents made their own soap. They processed their own hogs. They made lard from the hogs. They did things because they had to. And I don't have to now, but it could be that way in the future. So I've bought a soap making book. I bought a canning book. I've done canning, but I'm no expert. I bought hard copies just so that they're not digital, and I will always have access to them if something were to, knock the grid out or knock down cell phone usage, things like that. So even going online and printing out articles on certain things, you can go online and find an article on first aid. If you don't want to buy a book, you can, print it out at home and have a hard copy somewhere in your go bag. Just basics, ropes, knives, things that you can use to get out of the weather, a piece of plastic, ponchos, thermal blankets. There's a lot of things that you can put in a bag that doesn't take a lot of space, relatively expensive, that if you need to, you can put on your back and walk 20 miles. And when you get there, you've got something to eat, you got something to drink, you've got something, warm to get into, you got something to get you out of the weather, and you've got something that's like a knife that you can protect yourself with to some degree, or, process, meat if you had to, things of that nature. So, one guy I saw on social media, he was talking about go bags, and this is a very good point because I haven't done this, but I saw the value in it. I've got a lot of stuff in mine. It's full. It's so big I had to get a bigger bag. He says, take your go bag and walk around your grocery store one time. He says, you'll find out you've got a lot of stuff in your bag that you don't need. So that when you get out on the road and you've got, this idea that you're going to walk 20 miles to get to your next location, you realize that it's not practical. You've got too much stuff. So those kinds of things, dry runs, I think we should all be thinking about and exercising.
Yeah, great points there. Yeah, I have a go bag as well, or a bug out bag in the back of my truck, and yeah, I probably have a little bit extra in there, but I've dwindled it down over the last couple of months as well. Just thinking about that, and great point there. Making sure even just printing off articles or things that you might need. Just remember, during a disaster, during a shit hit the fan situation, you might not be able to, get on a computer, get on your phone or something. So being able to do that as well. I was just thinking when you're talking about books, I bought this book. I saw a lot of preppers had it. It's called the Prepper's Medical Handbook.
Mm-hmm.
It's a great book. I actually picked it up and started reading it a little bit, and has a lot of great points. You can pick it up on Amazon. I think it was less than $25, but it had a lot of great stuff that most average people, even if you take a first aid class or something like that, doesn't have. So making sure that you have books and written material as well is definitely great. And great to have. Well, Tim, thank you so much for joining us today on the All Hazards Preppers Show. I look forward maybe to having you on in the future again, to, especially when we get into hurricane season or something like that. And definitely all my followers, make sure that you are liking and subscribing to this podcast on either Spotify or Apple Music, and making sure that you're still following our content on Facebook, on Instagram, and on YouTube. I have some exciting things coming on YouTube this week as well. And super glad that you have joined us today for the podcast. Tim, thank you so much. And everyone stay safe out there and have a great day. The All Hazard Prepper out.